So I'm the Dean of the Faculty of Health and Social Sciences. It's one of the 4 faculties at Leeds Metropolitan University. We're a large university of 30,000 students, and the faculty is one of the 4 faculties. We have about 6,000 students, undergraduate and postgraduate, across a wide range of disciplines covering health and social sciences. We're divided up into 4 schools, and we have a research centre with some internationally leading research. Work-related learning is an extremely important part of the experience of all of our students. For students who are studying for health and social care related programmes, particularly so, they spend probably the equivalent of a 3-year programme. The equivalent of one of those 3 years will be spent out in a variety of practice placement settings, so it's absolutely crucial that we're able to coordinate those placement settings as part of their degree. But more broadly, for degree programmes, students that haven't traditionally had placements, increasingly, because we want to promote their employability, we're seeking to expand the range of work-related opportunities to improve their graduate employability. So again, as we were approaching the challenge of how do we improve this, we wanted to increase the efficiency of managing the placements for our students on the health programmes, but also have the capacity to be able to improve the graduate employability opportunities through work-related learning for the rest of our students. There are about 6,000 students within the faculty itself and 30,000 across the university, so the logistics of coordinating placement opportunities for such large numbers of students with a wide plurality of placement providers across a huge geographical and indeed national region presents quite a complex logistical challenge. So as a faculty, we work very collaboratively with a number of other universities, so one could go down a very competitive route when you're trying to find placements, but placements depend on close partnership working between universities and the health sector, the social care sector, where services are being provided for patients. And so we work in a close partnership, and because we work very closely with our other universities in our region, we decided that what we needed to do was to work collectively on that task of allocating placements. People providing the placements would much rather that universities are working in a coordinated way to work with them, rather than each university approach them separately with requests for placements and with different systems for supporting their students. So we actually work closely in particular with 4 other universities, and through the work we've been doing, we now coordinate placements across a number of disciplines on behalf of other universities as well as our own. So if I go back to how we used to go about coordinating placements, I think it'd be fair to say that what happened was that at each course level, so if you had a physiotherapy course or a nursing course or a speech and language therapy course, each of those would go about in their own unique way trying to source the placements, and it was very ad hoc. In some cases, literally people would be using post-its and individuals would be ringing up colleagues who they used to work with in hospitals. In other cases, people had developed their own basic spreadsheets to try and coordinate that. So what we wanted to do was firstly to bring all of the different placement activity into one place. So we established a faculty placements unit. But then the task was to source really an IT solution which would help us to convert a lot of the paper-based systems that we had for coordinating placements across disciplines and working with other universities into one integrated system which would allow all of the essential information to be held in one place and allow us to integrate and coordinate that activity across multiple disciplines and across a number of universities. We wanted to see if somebody had already invented such a wheel before having to go and invent one ourselves. So we spent a fair bit of time. We started off simply by asking the question across our own university, were other parts of the university coordinating placements using systems? And we very rapidly concluded that they weren't. We then looked around to see, both within the UK and internationally, whether there were some off-the-shelf systems which would do it. There were some, but they fell well short in terms of the sort of things we were looking for. We looked at the possibility of building our own from scratch and ruled that out. And so that led us through the process to InPlace, which provided a system which we could see had the flexibility to be developed to meet the needs of what we were seeking to do. And probably with the hindsight looking back then, we weren't entirely sure of all the things we wanted, and as we've gone through the process there have been features which we now have embedded which have emerged through the more detailed work we've undertaken. So where we've reached at the moment is that we've now got probably about 16 to 18 different disciplines, including all of the health disciplines within my own faculty, also the social care disciplines, but also some of the other disciplines. So for instance, we've got a criminology degree programme, and we have a placements with the regional police force. So in developing it from a particular model for health programmes, we've not only been able to include those, so for instance nursing, physiotherapy, occupational therapy, speech and language therapy, a whole range of health disciplines, but also social care disciplines. And for each of those we've been able, through the way in which we can allocate the placements, to factor in the particular way in which the placements need to be organised. So some of those disciplines need numerous short placements structured in such a way that by the end of a series of placements a student has gained the requisite experience. For others they have much longer placements. And the system allows for that variation in the requirements of the different systems. But not only that, is we've been able to work and integrate into that the collaborative working with other universities, so that for instance for physiotherapy we are able to coordinate all of the placements both for Leeds Metropolitan University but also on behalf of 3 other universities. So all of the physiotherapy students on the courses, on all 4 courses across all 4 universities, can be coordinated off a single set of data working with placement providers, which is a massive benefit. So some of the advantages of having all of that information in one place are that we are able to look at any particular placement provider and understand what their capacity is, not just for, say, providing nursing placements, but for providing placements across multiple disciplines. It also means that all the information, such as the information about that placement setting, about who the supervisors are, how to get there at a very practical level, is all there in one place across multiple disciplines. If there are any changes to the placement setting, one series of updates of information could be done rather than have to do that across multiple ones. It's got benefits because increasingly we want to be able to structure learning to take place across different professional disciplines, interprofessional learning. Now in a university setting you can do that by timetabling students to come together in particular ways. What we haven't been able to do particularly well in the past is to coordinate the allocation of students from different disciplines out into different placement areas. We're now able to do that so we can actually structure the placement allocations to promote interprofessional learning opportunities out in those areas. So you ask the students, well, what do they think this is doing for them? Then, firstly, if we even take it back before they join the course, a lot of students want to know, before they even come onto the course, who coordinates the placements? Will I have to find the placements? How far in advance of going in a placement will I be given that information? So, particularly for mature students who've got childcare responsibilities, knowing when they're going on placement, knowing the distance they're going to have to travel to placement, is crucial information for them in order to be able to plan their lives and plan childcare support. So we're able to reassure them, if you like, as a frequently asked question, about the timing, the fact they will get advanced information. We'll be able to give them information about their placements right across the whole of a year, so that they're able to make suitable plans. When they're actually enrolled on the course, it means that they have access to all their placement-related information in one place from a single login. They're able to record and store all of their placement-related documentation. So for instance, they have to have health clearance checks, criminal record bureau check. That information is held on the system so the student can see that. But as a university, we can also make sure that they've had the appropriate checks before they go out into placement area. All of their assessment documentation can be stored on the system in one place. And also at a very practical level, in the UK we've got a Google map system, so they can actually plot and get information to show them how to get from their home to the placement settings. It'll tell them the bus journey, the times. So it's quite anxiety provoking the first time you're going off to an unknown location. For a student to be able to actually have that information is an enormous benefit to them. And then they can also submit online evaluations at the end of the placement, which again is important both for the student because it's easy for them to do that, but it's important for the university because we can then collate all of the feedback information about particular placements. And because of the multi-professional nature of that, let's just say Ward 22 is a placement. What it means is that we can look at all of the evaluations coming back from Ward 22, from nursing students, physiotherapy students. We can look at the evaluations coming back from the tutors on Ward 22. So if they're all positive, then okay, there is no issue. But if we start to get a recurring theme of some negative comments coming through, it allows us to be responsive and supportive and work with that placement provider in order to understand what remedial and support action we need to put in place. I think one of the things that has really come through quite recently really as a key benefit of this system is that it is really important that we can look at the relationship between the quality of the feedback that we're getting from students and from tutors in particular clinical learning settings, and be able to match that or check that against the audits of clinical care, so the feedback that's coming through into those units on the quality of patient care. And in the UK that's been a really significant issue over recent months, where there have been some institutions and some parts of institutions where there's been very poor quality of care, and yet students have been going into those environments and there hasn't been any pickup really in terms of that. So what the system will allow us to do now is, because we're able to get multiple feedback from multiple students and drill down right to a particular part of a placement provider organisation, is we would then be able to share that information and match that information against the audits of clinical care. So we'd be able to see if there, for instance, was an area where there was reports on poor quality of care, with poor quality of learning experience, and be able to take joint action between the placement provider organisation and the university to address any concerns that were arising. The other thing it allows us to do is to, when we're looking at expanding courses or developing new courses, is because we can obtain accurate information about the capacity of different placement settings, rather than develop a course and then find ourselves in a situation where there is insufficient placement capacity, we can do some predictive modelling of the placement capacity before we actually develop the curriculum. And we can also design the way in which placements and the academic studies are integrated based on the availability of the placement area. So historically we might have been asking placement providers for placements over, for the sake of argument, just 30 weeks of the year, as all universities are. So there are significant periods of the year where there's capacity which isn't being used. So we now can inform the design of the courses so that we're using to full benefit the learning opportunities in those placement settings right across the whole of the calendar year, not just the academic year. So there's an efficiency, productivity element to this as well, in that with the increase in the number of placements that we need to coordinate, that would have led to an increase in the number of academic staff, because it was academic staff who were spending substantial amounts of time doing some fairly routine matching of students to placements. What we've found is that so far we're estimating that we've reduced the amount of academic time into the sort of simple matching of placements by about 50%. And by centralising the process, it's delivering significant efficiencies in terms of the way in which we're able to do that. The benefit of that is not that we are getting rid of lots of staff, but the staff who were, particularly the academic staff, who were spending lots of time simply trying to ensure that we had the placements, are now able to devote quality time in those placements to working with staff, working with students in those placement areas to improve the quality of the learning experience. So that's getting a much better use of their time, leading to much greater improvements in the student learning experience, rather than simply be spending lots of time on the phone, ringing around trying to ensure that we, in effect, weren't in breach of contract by not being able to provide students with placements, which is part of their expectation for their course. I think for somebody who's looking at the system, they've first of all got to have a very clear understanding of how they're currently coordinating their activity. I think they'd be well advised to visit, talk to somebody like ourselves who've been through the process of configuring this to see how we've gone about it and what the system actually does, because probably it's fair to say, even though we've done quite a detailed scoping and we thought we were very clear about the mechanisms we wish to deliver, as we've gone through the process, there are things which we can now do which we probably hadn't anticipated. So I think having a good dialogue with somebody who's already gone through that process, flexibility is the key. Sometimes the way in which people are quite passionate about the way in which they currently do things and they want the system to replicate that, but there may not be the best way of actually going about it. So I think they need to go into it with a degree of open-mindedness about the fact that there may be ways which the system can deliver better ways of coordinating their activity. Well, we've been developing the system now for 18 months or so. We're running now, we're starting to run with all the health and social care disciplines. We're very pleased with what we've got so far, and as a university we're investing now in a scoping project to look at how we can roll this out in effect across all 4 faculties. That won't be a quick 6-week job, but what we will be doing is looking at where and how we wish to apply this to other disciplines. So for instance, teacher education, looking at our business and law faculty, because the way that the system has been configured, it was always configured in anticipation of the fact that we would be wanting to roll this out right across the university. So for instance, we will have numerous students perhaps in a particular hospital environment from a health discipline, but equally we might have students, say, from a human resources degree programme working in the human resources department of a hospital. So we would be able to again capture all of the students from our university that are working in any particular organisation. Possible further developments would be for us, because we will have a record of which particular placement students have been into. Increasingly we're doing more work with our alumni, so we want to keep in touch with our students as they go into employment. So it would be interesting for us to be able to use the more detailed records and tracking that we've now got to see if there are any correlations between the types of placement that students experienced and where they've gone on for further employment. I mean, certainly anecdotally, what we find is that students who undertake placements, who like those placements, the employers like them, quite a high percentage of those students then go on and become employees within those organisations. So that's important for those providing placements, because potentially the impressions they're creating, the kind of support they're giving to students may encourage them to apply and be their employees in their workforce of the future.